There is no doubt about it. The COVID-19 pandemic is causing a lot of uncertainty and hardship. Each day, you may be hearing stories about things that are in short supply, medical equipment, work for many people. And then there are the stories of those who've fallen ill and what's expected as this continues. It's a lot to take in. But it turns out it's also a time of something that people aren't short on, and that's the willingness to help. Here at the Atlanta Regional Commission, which powers this podcast, we're hearing a lot of stories about people going the extra mile to make someone's life better here in the ATL during this pandemic. We thought you'd like to hear one of these stories too, along with some tips on how to help your neighbors. So today, that's what we're doing. This is What's Next ATL, where we explore the big new ideas shaping Metro Atlanta. I'm Kate Sweeney. And today, we talk with Ken Kim, who works with Senior Services at the Center for Pan-Asian Community Services, or CPACS for short. CPACS is an Atlanta nonprofit dedicated to helping immigrants and refugees with a wide range of needs, from transportation to healthcare to ESL to SNAP assistance. CPACS is a lifeline for many immigrant and refugee families in Metro Atlanta, and that includes people 60 and older. The story we tell today starts a few years back, before this coronavirus pandemic. See, a few years ago, CPACS recognized that there was a gap. A lot of senior centers across Metro Atlanta offered something called congregate meals. These are meals where people get together in person, eat, and just as importantly, socialize. Last year, ARC allocated federal and state funding to help provide more than 280,000 such meals across the region. CPACS wanted to offer congregate meals, but the funding that made those meals possible also had general guidelines for nutrition, guidelines that seemingly were not designed for the kinds of foods eaten by many older refugees and immigrants served by CPACS. Here's Ken Kim.
It's really hard for Chinese, Koreans, Vietnamese, Bhutanese, and so forth to eat spaghetti, sandwiches every day. It really does not account for the diversity. So it is hard for our seniors to eat those meals in regular fashion.
Right, because there's no point in having meals that meet certain nutrition guidelines if people aren't consuming them.
Right. When you have your home food, you feel right at home. So that's really important, I think.
Working with gerontology and nutrition experts, CPACS staff arrived at recipes for nutritious, culturally appropriate dishes for each group of older people they served: Burmese, Bhutanese, Chinese, Korean, and Vietnamese individuals. These dishes were largely rice-based, with different broths, vegetables, and proteins depending on the country of origin. Then, working with staff from the Georgia Division of Aging Services and ARC, they were able to access funding to serve those meals. And once CPACS was able to start serving older individuals the kinds of foods they knew and loved, things started changing at its senior center.
One example would be Burmese refugees. They were a bit scared. They didn't know what this was about. They are stuck in a UN refugee camp 10, 20 years sometimes. It's very, very hard for them. So when we first had our Burmese seniors, they wouldn't stand up to even get a cup of water. But fast forward a little bit, they are dancing, singing, making requests about different dishes. So they are now having fun.
Which is what you want. This kind of relationship in which the older people felt comfortable enough to suggest changes to the recipes and get up and sing and dance, that signaled that there was an element of trust forming. More than a meal, this gathering represented a critical community. And then COVID-19 came. How and when did your team and your partners first begin to realize that this novel coronavirus might affect your congregate meals and group activities?
About 3 weeks ago, we began noticing some of the senior centers at different counties closing down. And there were meetings at the Atlanta Regional Commission where senior center managers would come in to talk about different issues. There were concerns about being able to keep the senior centers open. There wasn't really a big of a problem from meal point of view for senior centers because they have a home deliver meal program where they deliver the meals, but we don't have that.
How concerned were you?
We thought we would be shutting our program down because all we did for senior services were mainly congregate meal program and recreational activities. Of course, seniors come here for all other social services, help with their Medicaid, Medicare, energy utility assistance. Anything they get that's written in English, they panic and come in and we help.
And so, so that translates that if CPACS hadn't been there, these older individuals wouldn't have had anywhere to go.
Right, exactly. And as you can imagine, even without the COVID-19 issue, the refugee immigrant seniors are at risk for isolation, social isolation. Obviously,
right. So, in some ways, they still don't have anywhere to go, right?
Exactly. The transportation issues, language issues, cultural barriers. So they are already very well isolated in many ways. So with the COVID-19, they're stuck at home.
So his staff and partners began a series of emergency meetings and research sessions.
In researching, we found that some of the Asian countries, including Korea, had a very well-developed ready meal products.
They wanted to try home delivery. It was the only way many of those they served would get the meals they had come to depend on. But first, they had to see if they could compile a series of shelf-stable meals. That is, meals that could be stored safely at room temperature for those 5 different ethnic groups. And they had luck. In a matter of days, after scouring the stores and working day and night, Ken's staff was able to compile a menu.
We have beef bone broth. We have salted seaweed, abalone porridge. Of course, we add in fruits, oranges, and so forth.
Within just a few weeks, CPACS, an organization that had shifted to offering congregate meals, now shifted again. With the help of their partners, they were able to transfer the funding that normally covers congregate meals. Now it would cover home-delivered meals and a new drive-through pickup service. They were in business. What kinds of challenges did you face?
A lot of seniors, especially refugee seniors, don't even have cell phones. Our protocol requires you to call them and drop off the food, get back to your vehicle, and call them back just to make sure they open the door and pick it up. But for some seniors, we really have to knock on the door because they don't have any phone. In some cases, first couple of days, we had seniors who would not open the door. We understand they are scared, but more and more seniors are signing up for it.
Of the 500 or so people who came to CPACS regularly to get congregate meals, 250 residents of senior high-rises in places like South Buckhead, Snellville, and Brookhaven now get home-delivered meals, a number the organization hopes to grow. But now, more than ever, it's about a lot more than meals.
We want to make sure that seniors have food that's not just from a can, but the main thing is for us to check on them. At a distance, we need to maintain over 6 feet of distance. We ask if they're okay, got enough food, do they have any problem. We have a federally qualified health center. And if they have any problem, then we can refer them. We want to make sure that they feel they are not alone. Most of our seniors went through a tough time, but they were together either with their family members or their friends. Now, you're really isolated in many ways. So we just want to make sure they know that someone's going to check on you. We care about you. There's somebody watching over you. That's basically all we want them to understand during this time.
What has it been like to be able to address this particular problem? Are you able to stop and think about it and feel good about the work you guys have been able to do? Or is it on to the next thing?
So it has limited us. We used to enjoy the sound of Korean traditional drums that seniors play when we come into the building. The seniors singing and dancing, but that's all gone. They are not able to do that. But till then, this is what we can do. If we can make any difference whatsoever, just let them know we're still here. Then I'm sure it may just be easier for them. There's a hope at the end that they're going to wait and then come back in and dance and sing and play the drums. That's what we hope for.
Ken Kim with the Center for Pan-Asian Community Services. The organization cannot take volunteers at this time, although they're hoping to secure a small truck that could handle hot and cold foods in order to increase the variety of what they can offer beyond shelf-stable meals. If you are looking to help, Kim suggests checking in on older people in your own community. Connect via neighborhood apps like Nextdoor or your neighborhood Facebook group. If it's within your budget, consider helping them out by placing online grocery or restaurant orders for them. Of course, now is a great time to support your local food pantry as well. That's our show today. Our website is what'snextatl.org/podcast. If you're enjoying What's Next ATL, please share us with friends and leave us a review on Apple Podcasts. And until the halls of CPACS can hear it again, we'll play you out with some Korean drumming from right here in the ATL. Thanks, and take care.